Okay, in this podcast, I really want to talk about thyroid antibody levels and what it really means about your thyroid function. Because one of the things that people are confused with is once they finally figure out that they have Hashimoto's and they're being managed for Hashimoto's, they want to get their antibodies checked all the time. And they want to determine if their protocol is working by looking at their antibody counts. So let's talk about antibodies first. Let's talk about what they mean when they go up, when they go down, and also what they don't mean when they go up and down. And what's the big picture, and what are the things you need to know about antibodies if you're measuring them all the time, if you have Hashimoto's, or should you measure them all the time? And if so, how often, and all those little subtleties. So for the most part, when you look at thyroid antibodies, the two main antibodies are TPO antibodies and thyroglobulin antibodies. And either one of those being elevated indicates that a person may have Hashimoto's. So let's just stick with Hashimoto's for now. We're going to avoid Graves' disease. The only difference between Graves' disease is they have a third antibody called TSH receptor antibodies. And with those autoimmune responses, the autoimmune response is much, much, much more aggressive. But we're just going to stick with Hashimoto's, which is your most common cause for being hypothyroid. So once you have Hashimoto's, you will then have elevated TPO antibodies. Now, the first thing you need to understand about TPO antibodies is that the antibody themselves isn't directly related to the severity of the disease. So let me explain what I mean. If you have, let's say, TPO antibody, if one person has TPO antibodies of 50, and another one has a TPO antibody of 500, and another one has a TPO antibody of 5,000, it doesn't mean the one that has a TPO antibody of 5,000 is worse. As a matter of fact, you could have a person who has a TPO antibody of 5,000, and the person that has TPO antibodies of 50 are actually much, much worse and have greater destruction and inflammation of their thyroid gland. So the thing to understand about the antibodies is that the antibodies themselves don't destroy the thyroid gland. So let me repeat that. The thyroid antibodies themselves don't destroy the thyroid gland. Okay. And what you have to understand about Hashimoto's is that there are B cells involved, which make antibodies, but don't destroy anything. And then there's T cells involved that attack whatever the antibodies are, and they're actually involved with destruction. So when you're looking at the Hashimoto's autoimmune response and you look at antibodies, you have to realize that it's the combination of antibody levels that bind to proteins, like in this scenario, thyroid proteins, TPO. And when they bind to proteins, that signals T cells to come destroy them, but you could have different scenarios. You could have a scenario where you have antibodies that are high, but T cell activity that actually destroys the cell being very low. So even though their antibody count looks really, really high, they don't really have significant destruction. You could have a scenario where antibody count's not that high, like 50, but their T cells are so aggressive that there's some degree of massive destruction. So you can't just look at antibodies alone to determine the severity of the disease, right? So let me give you some more examples. So let's say you have a scenario where a person has thyroid antibodies and their TPO antibody levels are 500. And by the way, most labs will have TPO antibodies anything below, or I should say anything above 35, anything below 45, 50 is considered positive, okay? So let's say we have someone who's got TPO antibodies in the 500 range, so clearly high, right? This is not common, but it does happen. And their antibody count's elevated, it's pretty high, and they also have very aggressive T cell responses. Their T cells that destroy tissues are very aggressive. So in that type of clinical scenario, there's going to be massive destruction of the thyroid gland. And it could even be to the point where they get Hashimoto's thyroiditis and actually go into an overactive hyperfunctional response. So when people develop Hashimoto's and get into overactive thyroid, that can happen when the B cells are extremely high and the T cells are very, very aggressive. They can actually get into overactive thyroid function, hyperthyroidism, and be very severe. That's an active thyroiditis caused by Hashimoto's. It's not a common expression of Hashimoto's, but it can happen. But you need both things to take you there. You need the high antibodies and the high T cell response. Let me give you another scenario. You get another person, their antibody count's 500. Their thyroid antibodies are extremely elevated, but their T cells are not functioning very well. Their T cells are not able to destroy much tissue. They're compromised. So with them, even though their antibody count's high, there's minor destruction of the thyroid gland. And, even year to year to year, they don't need to increase the thyroid hormone replacement because even though their antibody count's high, there's not much tissue destruction taking place. It just looks really bad, but there's not this compromise of the tissue over time. Then you could have another scenario. Well, let's say you have a person whose antibody count is 60, just a little bit above the lab range. So they don't look like they're that bad, but their T cells are really, really aggressive. In those cases, you get severe thyroid destruction. And even though their antibody counts are a little bit high, their T cell response is so aggressive that they completely fall apart. And when a person doesn't understand that there's both T cells and B cells response, it's very easy to look at, oh my God, this person has an antibody of 500 and this person has an antibody of 45. So the one 500 has got to be much worse. So the answer to that is not necessarily. It really all depends upon what's happening with your combination of B cell and T cell activity. Let me give you another just random example. Let's say someone has thyroid antibodies of greater than 10,000, and it does happen. There are some people that have very, very high antibodies, but their immune system is their T cells are not responding at all. They have really high regulatory T cell activity. They may not, even though their antibody counts in the 10,000 range, they still may not have many symptoms and not progress forward with their thyroid destruction because, once again, they're not having this aggressive T cell response. So more aggressive the T cells are, the greater destruction you have. And T cells will churn on and attack tissues that have antibodies on them. So the combination of antibodies and T cells are really what determines the Hashimoto's response. So that's the issue with severity. Now let's talk about what about for yourself? What about when you check antibody levels? So one of the key things about this is that you can't compare your antibody count to someone else's. For someone else, they could have that TPO of 500 and they get it down to 300, and that's different than you. Maybe you have an antibody of 50 and you're much worse. So don't compare antibodies from whatever yours are to someone else's because you don't know what's happening with their T cell responses. But studies clearly show that for the individual themselves, without being compared to either one, whatever their baseline antibodies are, it can be used as a way to determine if their autoimmune disease is flaring up more or it's calming down, okay? So if your antibodies were 200 and you did something, some intervention happened, and you did another test and your antibody count went from 200 to 2,000, then something triggered your autoimmune response. On the other hand, if your antibody count was 200 and you did something, they went down to 70, then you may have had some beneficial responses. But remember, that's only looking at the B cell response of antibodies, and that's not the whole picture. So be very cautious of how you look at antibody levels. So they're not associated with the severity of the disease. However, they can go up when you flare up the autoimmune response. The last thing I want to share with you in this podcast about thyroid antibodies is you got to know what's realistic. Like, don't expect your antibody count to go completely to zero. It can happen with some people, but for the majority of people with Hashimoto's, their antibody count's never going to go down to completely out of range normal. You just see those fluctuations. Because if you expect your antibodies to go completely down to zero, you might be very disappointed, even though you're doing a lot of things that are changing the expression of your autoimmune response overall, and you're functioning and feeling better, and so forth. So those are the main things I wanted to cover with you in this podcast about thyroid antibody levels. If you want to learn more concepts and learn how to develop your own personalized approach to Hashimoto's by understanding all the current literature and how to apply that for yourself, please check out my program called Hashimoto Solving the Puzzle at drknews.com. And thanks for your attention.